Welcome to Break Everything. Your host, Lisa L. Levy, will guide you through critical thought conversations and a journey of directed disruption that makes a difference. Experience bold conversations with industry leaders who are willing to challenge the status quo.
Hello and welcome to another edition of Break Everything. Today I am really excited to have a conversation with a founder who is driving forward the use of AI in the care, especially for our elderly patients. For those of you who have been with me on this journey, you know that this podcast platform started because of the experience I had with my granny as she was going through being elderly and needing health care, the challenges we had in the hospital, all the way through end of life and getting into a hospice facility, and how incredibly frustrating and horrifying it is to be elderly and not understand what is going on around you, not understanding the words that are being spoken, and not understanding what people need from you in order to help you feel better. So I am so incredibly excited today that I have Dr. Renee Dua with me. She is the founder of a company called Renee, which is the first ever healthcare assistant that combines human support with advanced AI to help patients navigate their experiences. She's also the founder of a company called Heal that she'll talk more about as we go through this journey. But she is an innovator, she is a disruptor, and it'll be really obvious as we have this conversation why she's here with us today. Renee, thank you for joining me.
Thank you so much, Lisa, for having me.
Absolutely. So I don't go through in the introductions all of the things that are who you are, because it's so much more impactful if you share with the audience a little bit about your story. Tell us about your background and how it is you chose healthcare and got to where you are today.
Certainly. So again, thank you so much for having me, and it's great to be here, and happy holidays to you and your listeners. A little bit about me. I am a practicing kidney doctor. I've been in practice for about 20 years. I'm also a mother, and I'm married to my co-founder. When I was starting my practice 20 some years ago, I put up with the complications of being a doctor in private practice, which in medical school, we do not learn how to run a business. I had to teach myself lots of things: banking, marketing, human resources. I installed an EMR. I was the first doctor in my community to install an electronic medical record system. When I got married and my husband and I started to have children, it was really a disastrous experience for us. Lots of medical errors, lots of disappointments from, doctors themselves. And so Nick and I thought about how we could improve the doctor-patient relationship. And one day on the way home from an emergency room visit, which was awful, I said to Nick that I wished I could be a better doctor and mother. I was failing, frankly. I wasn't a great wife either. And I said, what I need for you to do is build me an app where I go on and off like an Uber, and you become my medical assistant and you drive me around and we see patients in their homes, right? I can spend time with them, but then when I'm not working, I can take care of our family. And Nick did that for me. He built an app, which he and our co-founder called Heal, right? A play on words, where the doctor came to you. You use this wonderful software experience to book a doctor's visit. You saw in real time how much it was going to cost you. You got to use your insurance. And while we were in the house, we would set the members up with one-touch telemedicine and remote monitoring devices. So now during a pandemic, you see all of this all the time on every corner. 8 years ago, we were thinking through a primary care experience that way. Heal became very successful, expanded through 13 states. We saw nearly 300,000 house calls, and we accepted about $200 million in investor capital, the most recent of which was from Humana, a large MA plan. And when Humana took over and invested that money, Nick and I both left the company, and we started something new, once again, born out of an experience where I have become the caregiver for our 4 parents and our children, of course. And that experience led me to tell Nick, I wish I could automate myself. right? I am making appointments. I am dropping off medications. I am reminding to take medications. All of this does not need to be done by a human being. A lot of this can be done with software, automated software, intelligent software. Nick named the company for me, Renee, and all the workflows and all the ideas we have inside that company are mine, born out of how I take care of my parents. My father's been especially sick this year. I have put him on the Renee platform to some extent to give myself a break, but also to make sure that someone like him who is older, who is sick, is getting the benefit of both a human and software to remind him and proactively take care of things for him.
That's absolutely fabulous. And I want to dive more into Renee and all of that.
Certainly.
But before we do, talk a little bit about why you pursued becoming a doctor in healthcare initially. And with the creation of Renee, what is the best part about what you're doing today?
Certainly. So both of my parents are doctors. So this is a genetic problem, if you will. I grew up with two doctors in the house, and my parents are from the generation of doctors where, very frankly, patients come first, right? Not kids, not their own parents, their patients came first. There is not a memory I have of my childhood that does not include a stop to an ER to take care of somebody, an ice cream bar from the hospital cafeteria, not a memory. Right. So this is who I am. And my father, like me, is a kidney doctor. And I think that it's only fair to give my parents credit for what they did for me by giving me the gift of understanding patient care. I am an old school doctor as well. I still practice to this day. I will never stop. It is important to me that it's a part of who I am, that I can see my patients. I have patients who have followed me from my fellowship, who have been with me for 20 years through all these pregnancies, through all these other companies, dropping off candy boxes and sweaters and blankets. I love them. They love me. So that's a little bit about, who I am and how I got here. I think I'll never stop seeing patients, but the fact is I always how do I want to say this? I always pursue medicine in a hand-to-hand combat way. I like democratizing things. Everybody should have house calls. Everybody should have a personal health assistant. When I'm in my office and I'm seeing my patients, I go on their smartphone. I put them on YouTube. I show them how they can do yoga for free. I find deep breathing exercises that they can do. I deep breathe with them, right? I have the privilege of, because I have my own practice, of taking time and spending it on them and giving them access to a doctor who really cares about them. I want my software to do the same thing. So that's what drives me.
And Renee is born out of your experiences with your dad and understanding, I'm sure that, right, our baby boomers, our parents, there's a lot of them coming. And as they age, the healthcare needs are going to grow exponentially. And our system as it is not designed to support it.
Nor do we have enough caregivers.
And we certainly do not have enough caregivers, right? So we have a lack of scale. And with that, the patient experience will get worse and worse and worse unless we do
100%.
something like Renee. So go into some details and talk about how this AI is going to help improve the healthcare experience as people age.
Certainly. So Renee is a personal health assistant. And, this notion of AI, I think a lot of people say they're using AI. I don't think they're using AI, right? I think, the idea of artificial intelligence will come after we have some intelligence. And I think you and I can both agree there is a huge paucity of intelligence in the healthcare space, certainly in the United States of America, right? The idea behind Renee is you sign up online, you go to renee.com, renee.com. When you get there, you will see that what we are actually saying to you is we will deliver your generic medications to you. And that's the hook. We want to know what medications you take. We want to make it easy for you to get them. Once you sign up for Renee, you are onboarded. We get to know what medications you take. We help you transfer those medications to our pharmacy partners. And we get to know that you're due for refills in 90 days. Your primary care doctor is Dr. Barbara Smith in Louisiana. We know how to contact her to ensure you have your annual wellness exam. We know that you take your medications twice a day. We send you reminders. It's a beautiful user interface where you point and click, never type, and enter that you took your medications. You're reminded not to take your medications with grapefruit juice or to take them with food. You are asked proactively, have you scheduled your mammogram this year? You're 50, it's time, right? Let's get that done. So those medications and that little bit of knowledge about you allows us to build out this personal health assistant experience, thereby scaling the lack of caregiver. But once again, going hand to hand combat with patients, our members, to say, your doctor doesn't have time to do this for you. And your spouse, your son, your daughter, they don't know what you need. They're not doctors. Every person deserves a loving daughter who happens to be a doctor driving their day-to-day care to stay well. And that's honestly why Nick named it Renee. It's what I do for my parents. It's what Renee does for them when they're interacting with her, not to be too metaversian or artificial, but she is a personal health assistant, and that's what she does.
And talk about the adoption with the technology itself, right? There might be, people who, and I may be guilty of this, after a certain point in age, right? That there's people out there, they don't necessarily want to use the devices.
100%. Yeah. And for that reason, we always have human oversight, always. If you call Renee and there is a phone number on our website, you will be connected with a human, right? You will speak to a human. That human might even be me or my co-founder, my husband, Nick, right? We answer the phone too, because we want to hear what your pain points are. But we have concierges who can help you and who will answer your questions as well. We have plenty of members who tell us, I'm not comfortable with video. I don't want you to see me right now, right? Fine, we'll do their onboarding over the phone. We'll do their check-ins over the phone. We have plenty of members who tell us this is too slow. We don't want to be on the phone with you. For them, we have an experience where they can upload the pictures of their medications. We can start the process of transferring their medications to our pharmacy partners. And they may tell us, I only want to interact with the experience on the app, right? And of note, you don't have to download the member app. There is no downloading here. Every time you get an interaction from us, we will have a link to the Renee experience. You push it, you enter what you need. You need an appointment within a month, push. Your doctor's name is in there, push. You need to know when that appointment is, push. We communicate with you, right? There is no typing. So that I think has been how we've thought through people who don't want the headache or the hassle. They may not be comfortable with the tech. We've thought through how they can experience this without having to learn many new things. And I think the last thing I'll say is every single one of our members who's in a high deductible plan or on a Medicare plan or whatnot, we ask them for those details, because when we know what benefits they have, we can activate those benefits. So they don't necessarily have to leave the health insurance plan they have thinking it's not good. We might find out that they have a transportation benefit or they have mom's meals or something like this. My father has, an eyeglasses benefit, right? He wants help with eyeglasses. We're going to get that through his insurance, so he's actually utilizing the benefits of his insurance and having the support from Renee to get it done.
Right. So I want to hit that point just one more time, right? So the insurance that they have, it's a high probability that they don't even know what coverage they're paying for.
It's always
and so
a probability.
There's a high probability. Right. They've got their Advantage plan and they're doing all of the things that they're supposed to do, but they make their payment, but they don't know what they get for it. And so with Renee, not only are they getting the care oversight that they need, but they have somebody who is actually helping them take full advantage of everything that they are entitled to,
That's
that they're
correct.
paying for access to.
That's correct. That's correct. And, in the last year, a lot of members churned off of their Medicare Advantage plans. There was, that hit the news that a lot of major MA plans had to cut their guidance because they had lost so many people who had subscribed. And there are many new insurance plans in the MA space in the last year. How they're going to do, I don't know. Many of them are not doing well at all right now. And so what Medicare plans really need is members to stick around and be engaged. It is not a secret that Medicare and any insurance plan, frankly, don't know how to engage their members, right? Their NPS, their promoter scores are very low. They don't, and I have lots of opinions about this, which we can do on another podcast. But unless you put the patient's interests first and not your profit or bottom line, a patient is never going to trust you. Renee comes from the perspective of building trust, which is why we give you your meds. We have a phone number. You will call and talk to me. Whatever it is that we have to do to prove to you that we're a real company that really wants to take care of you, that trust can be then expanded into how you interact with your insurance plan.
And that's absolutely fabulous, because we have a challenge in our country with people not getting the medical care that they need, even if they have the coverage that would provide for it.
Absolutely.
And without taking us down the road of getting access to care regardless of your coverage, but I am horrified that if we have our MA plans, people are not going to the doctor because
Absolutely.
whatever their reason is, fill in the blank. And whatever they could be cared for, covered before it became something catastrophic.
Absolutely. And, during COVID, we know that 60% of people have not yet had their annual wellness exam for 2-3 years now, right?
Mm-hmm.
The first thing Renee does is books your annual wellness exam, because from there, all problems can start to be resolved. Your screenings, your labs, your refills, right? So we're very well aware. And I think, as you said, there's multiple reasons people don't interact with their health insurance. But I think the most critical of which is it's unnecessarily difficult. You can't get someone on the phone. You sit on hold. Let Renee do that. Let Renee sit on hold, right? That's what we're being paid to do. And I think when you take the brunt of those difficult problems off a member, you will start to see that they will engage, because there's less for them to have to worry about getting done, how to get done. And there's just the opportunity to focus on what needs to get done.
So with Renee is a growing platform. What do you see in the future? How is telemedicine supported by this digital concierge and digital tech? How is this going to transform the experience over time? What does the future look like?
So most importantly, Renee is not a provider. Renee is not a doctor's office. Renee enables care. When we know that you have X insurance and your telemedicine provider is Teladoc, we have the integrations to reach out to Teladoc and say, we have a patient who's already signed up on your platform and needs a video visit right now for an urgent issue. And we can coordinate that visit for our member, right? They don't have to leave the house. We already know it's in network. They've already been able to pay Teladoc for the $10 copay, and we are on our way, right? It's much easier. We do not want to be, as much as possible, in the provider space, because we want to expand the provider's back office, right? When I'm in my office, I pay people to call my patients and remind them to come to their appointments, to do their refills. It is very expensive, right? And we've already covered that I have the privilege of running my own practice. Most people don't run their own practice. They work for somebody, they're reliant on somebody. There's a huge staffing crisis with nurses and assistants right now. What we want to be able to do is say to a doctor's office, we're not competing with you. We're helping you. You want to make sure that when your patient is on 3 blood pressure medications, their blood pressure comes down. We can see that it's not coming down. We'll make sure to make an appointment with you to evaluate why it's not coming down. We see they're adhering to their medications, but maybe they need a 4th medication, or maybe they need a different medication. That will be your decision to make. So that's a really important distinction with us. We are not competition for doctors' offices. We are support for doctors' offices.
Well, and what you were describing in the blood pressure scenario, right? You are helping the patient get actual data points,
Absolutely.
capturing them in the system, on a, with regularity, assuming that they're following their directions,
Yes.
and providing meaningful data, trends, and patterns back to the provider
That's right.
that none of us would be able to do realistically
That's right.
on our own. I mean, that's absolutely fabulous support for both the provider and the patient.
Yes. Yes. Yes.
It's absolutely fantastic. So for you, for Renee, looking to the future, what do you want Renee to grow into?
So if you look at the tech space at large, there is no healthcare app for the millions. And that's really what I want Renee to be. I want Renee to have contained all the use cases a member might have: remote monitoring of data, blood pressure, blood sugar, telemedicine and urgent care, primary care, address book, mental health, which is so important to me, right? I want Renee to be able to be used by caregivers, for caregivers, their children, their parents. Everything that Renee does will put all aspects of healthcare in one place and communicate. Right? Your mental health provider says that when you're anxious, your blood pressure goes up. Is your primary care doctor aware that that's why your blood pressure is going up? You don't need another medication. You need to control your anxiety, right?
Right.
How these things communicate, and to me, that is the true interoperability of software, right? How it communicates to holistically look at a human being. No human is just diabetic. No human is just depressed. You can be depressed because you are diabetic. You can be depressed because it's the holidays and it's an anxiety provoking time, and you eat poorly, so your blood sugar goes up, right? Humans are complicated. So I hope for Renee that millions of users are able to connect and get their best health on this platform.
It's a beautiful goal for the future. What do you think some of the key obstacles are for that growth?
Right now, it's some of the most ridiculous things, right? Politics, right? How women can access care right now. Women are the chief medical officer of the house. They need to be able to access care. They need to be able to stay at work and take care of their children and take care of their, women, as you know, left the workforce in droves, right? Another terrible thing: doctors, nurses are leaving the workforce in droves. They're not respected or appreciated. When I was seeing patients during COVID and I was on, a news channel, I had mentioned to that reporter, I'm bringing home whatever you have. I have a little baby girl here. She is going to get COVID if you can't wear a mask, right? I think the lack of empathy, the lack of humanity in healthcare, forget about health tech for a minute. That's, I think,
Right.
a whole other animal. But the lack of humanity in what should be health, I think, is alarming and at its worst right now, right? Worse than I've ever seen it. And I've been around a long time. So I think these are some of the things that trouble me. And I'm hoping, as we're not out of COVID, but as we hopefully one day get out of COVID, which I think is also something of a dream, that we will put a little more focus on moms, on doctors, on nurses, on technicians who keep us alive.
Yeah. And it's a sad point that you make, right? The humanity in the things right now. I think we're at a low as a society, right?
Yeah,
It's not just healthcare. It's how we treat each other, in the grocery store is,
absolutely.
it's a tad bit abhorrent at times. So the challenges are very real and they're very human, right? We start with people, how we show up, how we behave, and that's something that we each as individuals can control. And for the future, right, bringing the care back into healthcare is absolutely important. I have one final question, Renee, and it's my favorite thing because I ask everybody, and I always think that I have an idea what the answer is going to be, and I'm always wrong. And I love that. I absolutely love it. So if I were to give you a magic wand and it removes all constraints and you could fix or change one thing in healthcare or for healthcare, however you want to take that, what would it be?
Well, you're only letting me have one. So I'm going to tell you what's top of mind at the moment, and that is women, right? We have lost some of our basic rights to make choices. And this will prevent us from being proper parents, proper employers, proper employees. I think women are master task managers and strategists, and their voice without it, frankly, because we haven't had it, is why we are where we are. I don't know how to say that more nicely. So I think more of an importance and a focus on women and what their needs are politically, from a healthcare perspective. And I mean, by the way, geopolitically, right? Watching what's happening around the world I'm to say disgusted, I think isn't sufficient. So more rights for women, and more of a focus on women and how they can function in society with respect and importance.
And the trend remains the same, because that is not the answer I had envisioned with what I knew about you going into the conversation.
What did you think I would say?
I think that it was going to be more along the lines of empowering, right, with the technology, so that we have the connections from at home to whatever we need. That's right. My mind creates these things with very little, input.
But do you know why I didn't say that? I didn't say that because I think we've actually done a lot of damage in the health tech world. Lots of itty bitty, unhelpful point solutions, lots of unethical solutions, lots of fraud, upcoding, we've done a lot of damage. And our market value has deteriorated, in no small part thanks to that. So I think we have to go back to the intelligence part.
Start with the human intelligence. And not to take away from what you were talking about, right? And women having a voice, having a say, and having control over making the decisions that are best for them, for their families, and for the people that are around them. And I do think that it is imperative that we should all be able to make the decisions for our physical well-being that are in our best interest, even if there are those who disagree with those choices.
Absolutely. Physical and mental.
Yes, absolutely. Absolutely. Renee, I am so impressed with what you're building with Renee and what the opportunities are for the future. Thank you for spending some time with us, sharing that. And if there are people who are interested in learning more, how do they find you or Renee?
So you can find Renee at renee.com, renee.com, and you can find me at renee.com.
That's about as easy as it gets.
That's right.
Thank you so much for the conversation. That concludes today's episode. And what a wonderful conversation we had. Thank you so much. Talk to you next time.
You have just experienced Break Everything with Lisa L. Levy. Critical conversations on directed disruption